Here from Vet Triage. We are going surgery. We're going to be talking about dog and cat wounds, electroceutical treatment of infected chronic wounds in a dog and cat. And that's right, electrocution. This is a crazy study. I love this stuff. It is a short case series. It's only 2 cases. But let's go through it. I love this concept. And chronic wounds in animals they're very annoying to deal with. Very annoying. They add up financially for the pet owner. It's frequent visits to the vet. It's Vets just constantly are discouraged by it because wounds take so long to heal anyway. If they're healthy, 10 to 14 days. Obviously, depends on where it is in the body. But chronic wounds can take months or even years. It's terrible. So this is a cool study that shows some promise. Comes out of the Ohio State University and the University of Florida. The objective is to describe the use of an innovative printed electroceutical dressing to treat non-healing infected chronic wounds. 1 dog, 1 cat, 4-year-old female spayed mastiff, 1-year-old female spayed cat. Chronic wounds, 1 year in duration for the dog, 6 3/4 months for the cat. After 10 days of treatment with the dog and 17 days for the cat, the wounds decreased by approximately 4.2 times in the dog, 2.5 times in the cat. Culture of the punch biopsies yielded negative results, meaning they didn't grow any bacteria. Wounds were clinically healed by 67 days, so a little bit over 2 months in the dog, and 47 days, so about a month and a half in the cat, and there were no further treatments required beyond. Introduction. Chronic wounds in humans are defined as wounds that fail to heal in 4 to 6 weeks. Chronic wounds show significant bacterial infection with recalcitrance. I had to look that word up. That means like stubbornness. Recalcitrance towards standard antibiotic treatment, meaning that standard antibiotic treatment tends to not work very well with chronic wounds. Domestic and livestock animal wound management costs were predicted to be $1.1 billion in 2021, with a 7% expected increase per year, and the costs are even higher for human patients. In human chronic wounds, delayed healing has been attributed to the presence of bacterial biofilms. Biofilms are bacterial communities encapsulated in extracellular polymeric substances. Biofilm characterize to treatments with antimicrobials and host immune defenses. In both veterinary and human patients, molecular diagnostic methods have identified a broad spectrum of microorganisms, suggesting that chronic wound infections are often polymicrobial, meaning that when you test these wounds, there's often more than one bacteria present. Bacteria were recently found to rely on electrostatic interactions for adhesion to the surface, thereby motivating the evaluation of electrical stimulation as a possible bacterial inhibitory agent. Electrocuticals, which generate open circuit potentials due to the presence of dissimilar metals in contact with a conducting fluid, have become an emerging treatment as electrical stimulation wound dressings. Electrocuticals such as Arthrex and Prokelera, those are both companies, have become commercially available with the United States Food and Drug Administration approval. These dressings use generated electrical fields from the open circuit potential to help disinfect, but have no current flow. In contrast, the treatment described in this study uses direct current with a battery pack as a source of electrical potential. So that's what this is here. This is right from the study. This shows the anode and cathode of this covering, and then the actual battery pack here, and there's the device, and so very, very cool. Direct current has been shown to have bacterial inhibitory effects against gram-positive and gram-negative bacteria. So bacterial inhibitory effects is important because you can inhibit bacteria or you can kill them, which is considered bactericidal if you're killing them. So bacteriostatic typically implies preventing bacteria from replicating, so multiplying, whereas bactericidal is killing bacteria. In vitro studies in the presence of electrical stimulation have shown that bacterial inhibition occurs due to the generation of hydrochlorous acid, not hydrochloric acid, hydrochlorous acid, which is HOCl. This is an antimicrobial agent. In addition to having beneficial antimicrobial effects, some studies have suggested that electrical stimulation may promote wound healing by stimulating angiogenesis, which is new blood vessels, and keratinocyte proliferation and migration. They have reported previously proof of concept of the feasibility of clinical printed electrocutical dressings used in dog wounds. The primary focus was on developing a treatment as a dressing with the design, fabrication, system engineering, in vitro disinfection, and electrochemical characterization of the printed electroceutical dressing in this study. One of the key findings reported was a proposal for a new physical biomarker, which was the electrical impedance of the wound, to monitor wound healing remotely with this device. Very cool. Very cool. Imagine you can monitor wound healing from remotely. It's unbelievable. Materials and methods. This device is powered by a 6-volt battery, maximum current limited to 600 microamps, or K omega ballast resistor. The largest dressings, which is 7.5 by 7.5 centimeters, presented an interdigitated electrode layout that maximizes the anode area for highest bacterial clearance. I think that's this picture here. This is the interdigitating, this pattern. For cat wounds, a smaller device, 1 by 2 centimeter, was used with a simplified electrode geometry to match previously reported in vitro bactericidal effects. So that's the smaller one here for the cat, bigger one for the dog. And apparently this design is bactericidal. This is so cool. Results. Applying it on the dog. 4-year-old female spayed mastiff, chronic wound, distal anabrachium, caused by a bite wound. Prior to this, the dog had 1 year of treatment with open wound management, negative pressure wound therapy, skin grafting that had 50% graft failure. For the cat, 1-year-old female spayed domestic shorthair, full thickness wound, left flank to lateral stifle, open wound management, advancement flap, which dehisced. Then they did an interpolation flap, which dehisced over the distal 40% of the flap 12 days post-op. They biopsied the cat wound later on, and they found eosinophilic granuloma complex. They treated with prednisone at 2 mg per kg once a day. After that, another biopsy confirmed that there was resolution of eosinophilic granuloma complex. Prednisone was then tapered and discontinued over 3 weeks, but the wound remained static. And so this is, here's again a picture of the device. You see it in the bottom there. Here is how they measured the wound. They used some computer program to measure the wound and some math, which, we're not going to go over because I don't understand nor care about it. And then here is the progression of the wound for the 2 animals. Very cool. You can see over time the wounds get smaller and smaller until you just have like a scar. Discussion. The 2 cases presented here show efficacy in eradicating persistent infections over a 10-day device treatment course for the dog, 17 days for the cat. Infection removal in both animals correlates to past in vitro studies where 3 to 5 log reduction in bacterial colony forming units counts for 24 hours for Pasteurella aeruginosa and Staphylococcus aureus. Lawn biofilms treated with electrocuticals were reported. With this device, in vitro generates reactive oxygen species, so HOCl, hydrochlorous acid, to mitigate bacterial infection. In both the dog and cat, no observations of cytotoxicity was recorded, which visually would be seen as abnormal discoloration of the wound or surrounding tissue. Other research has found cytotoxicity in excised pig dermal tissue, subject to electrocutical treatment, by reviewing results from a blinded histopathological assessment, which did not show differences between untreated and treated dermal explants. Less substantial inhibitory effects may take place over the cathode due to the electrical potential favoring production of hydrogen peroxide, H2O2. However, bacteria may be able to recover from the oxidative stress of peroxide-mediated disinfection. That's why peroxide you don't use in wounds. It causes desiccation of the wound, and bacteria can recover from it. Past in vitro results have reported eradication of antibiotic-tolerant variants that may arise in cultures. That's it. That's the study. Very, very cool. Obviously, we want to have larger case studies, more wounds, and all that stuff, but this is a phenomenal first start. Studies like this are great because they're straightforward and they address a real problem that we have in the field. All right, thanks for supporting the channel. We'll see you again tomorrow. Bye-bye.